Reinab or Reinab? Reinab. Okay,
Dear ladies and gentlemen,
Reinhabicht.
and I'm leading the WHO country office in Estonia, and it gives me a great pleasure to welcome you all to this parallel session. Health System in Transition is a series published by the European Observatory on Health Systems and Policies that systematically describes the functioning of health systems in countries, as well as reforms and policy initiatives in progress or under development. And in this session, we will launch the 6th edition of the Estonian Health System in Transition review, and we will talk and discuss about Estonian health system transformation over the years, its successes as well as its challenges. I had the honor to be part of the wonderful team together with Kaia Kasekamp, Triin Haabicht, Andres Võrk, Marge Reinap, Kristiina Kahur, Heli Laarman, and Julia Litvinova, who wrote the Health System in Transition that we are launching today. And I thank each and every one of you for your dedication to get it ready for today's event so that we can launch it today during the Tallinn Charter 15th anniversary celebrations. And I'm sure that many of you had sleepless nights and long weekends, and therefore we had a lot of pressure due to the timeline to get it ready. But I thank each and every one of you for the dedication, and it has been a real team effort. So thank you very much for that. Now about this session. We have divided this session in 3 parts. In the first part, we will have a presentation of the newly published Estonian Health System in Transition review. On the second part of the session, we will have a panel, and we will hear reflections from the distinguished panelists from the Ministry of Social Affairs of Estonia, WHO Regional Office for Europe, and European Observatory on Health Systems and Policies. And in the last part of the session, we will give all of you, dear participants, the possibility to ask questions from the authors and from the panel members. But now, without further delay, I have the pleasure to introduce you 2 speakers, Ms. Julia Litvinova and Mrs. Kaia Kasekamp, who will do a joint presentation. Julia is a research fellow at the Berlin hub of the European Observatory on Health Systems and Policies, and she's also the editor of the Estonian Health System in Transition review that we are launching today. Kaia Kasekamp is international health financing consultant and the main author of the newly launched Estonian Health Systems in Transition review. Please, Julia, the floor is yours. Thank you.
Right. Well, I'm happy to see people here, because last night during the reception dinner, I was insisting to the colleagues and saying, well, you gotta come to the Estonian HiT launch tomorrow morning. Well, as an answer, I heard, what is HiT? Well, I know normally in the wider audience would refer to hits and pop music culture. But we, the health system researchers and the collaborators of the European Observatory on Health Systems and Policies, know HiT as Health Systems in Transition series. And HiTs are truly HiT product of the observatory. And this is because HiTs provide comprehensive and systematic description of health systems of the country. HiTs focus on analysis of reforms and policies in progress or under development. And when they put together in a HiT parade, they draw a historical and detailed view of the transformation of the health system in the country. In the case of Estonia, the tradition of HiT parades goes actually back to 1995, and the not pictured cover of the HiT, because it actually hasn't been digitalized, so sorry about that. So we're going to start from the version 2000, 2004, and in the middle, the version of 2008 came actually parallel with the signature of Tallinn Charter. 2 HiTs later, We're now here at the 15th anniversary of Tallinn Charter and presenting the 6th official edition of the HiT. And I am honored to say that behind every success of the HiT, there are people who are passionate about telling the story of the health system. Success of the HiT is possible thanks to country experts who know the health system from within. And they are following the developed templates and working closely with technical officers from European Observatory on Health Systems and Policies, deliver the robust and independent analysis of the health system. So, again, in the case of Estonia, Observatory has been fortunate to have worked with dedicated experts, including Riina Sikkut, the current Minister of Health, who worked at the version of 2008. She was an author there as well. And besides that, the team of experts includes currently working change makers at national and international levels. And yeah, as mentioned, the HiTs, when put together, they show transformation of the health system, and when the teams of experts put together, show the transformation of the team, and slow overtake of female power in our case, including editor. So thank you, Ewout van Ginneken, the former editor of HiT, for putting your trust in me and guiding me through this process. And I'm mostly grateful to the team for your efforts. Thank you, Trine Habicht, for your critical eye and tough questions. They were invaluable. Thank you, Andres Vrk, I hope I did it right, for being our data whisperer and always having right numbers and right answers. Thank you, Christina Köhler, for your crucial view of the health system performance. And Margi Reineps, your warmth and positivity has been encouraging throughout the whole process. Thank you. Kristina Kahur, you've been very reliable and fast help throughout the process. And Heli Larman, who unfortunately is not here with us during this session, her focus on actually final goals of the HiT was tremendous. And most of all, I would like to now also invite to stage Kaja Kasekamp, the heart of this project. Thank you, Kaja, for your dedication and hard work. It's been tremendous. Thank you for sharing the load with me and now presenting the results of our efforts here together. Please, to you. Thank you.
Thank you so much, Julia, and thank you for the kind words. I'm so grateful of being here and having been a part of this, I would say, Estonian health system team of gurus who have just been such a pleasure to work with, and also having the support of the observatory throughout the processes of my second HiT now. It has been always a great pleasure to work with a team. So I am presenting you the HiT in not maybe the traditional format that the HiT has, because it has a defined outline, as many of you know. But I will be guiding you through of the main policy changes that Estonia has made throughout the past 5 years in its healthcare system, because this HiT focuses mainly on the past 5 years, and also on the most important data and the status where the health system is right now, and what may be some of the most important future challenges. So firstly, I'm going to talk about a bit on the health status, then on access and coverage of healthcare services, naturally financing, and which is usually the biggest part of the HiT, and one of the biggest parts, and then also a bit on health system governance. Then our health workforce is something that necessarily needs attention, and also we during the past 5 years, cannot avoid the topic of the health system resilience through the multiple crises that we have had, and I will finalize with some of the key takeaway messages. On the health status, so Estonian system has been hailed for its good health outcomes. It's actually been said that it has made the quickest progress in the whole EU in life expectancy, which is very good. But in Estonia, we also see that people live longer with poorer health. So at the age of 65, more than 60% of the people spend their remaining life with activity limitations. And we see from the data that the leading cause of death in the country are cardiovascular diseases. Keep this in mind because I will keep this focus in my presentation today. One of the biggest challenges that we see from the data are also the big gaps in health inequalities. So we see that there are inequalities in the health status, but we also see significant inequalities in how the people perceive their health. For example, 36% of the people in the lowest income quintile assess their health to be good, when in the richest income quintile, it's 78%. So where do these inequalities in health status, but also in health perception, come from? One of the answers may be the inequalities in access to care, because we do have limited coverage in Estonia. Approximately 4 to 6% of the Estonian population is not covered with health insurance. These are mostly the people who have unstable work. Furthermore, we do have a heavy load of co-payments in the Estonian healthcare system, and this is something that Andres Võrk will also today later present on the afternoon session on financial protection. But we see that due to the high co-payment levels, the populations with lower income are more likely to forego care, which tends to turning to healthcare systems at the status where their health is already bad, and they need to have, for example, emergency care, which is then entitled to them, even if they do not have insurance coverage for rest of the service package. A challenge that we see emerging in the healthcare system is allowing balanced payment at the primary healthcare level, which has not been the case in the past. The regulation states that we cannot have co-payments at the primary healthcare level except for home visits, but through the expansion of the primary healthcare services, we see that now the balance billing for some of the extended primary healthcare services is an increasing practice. And why this is a concern? Because we see yesterday we all signed the outcome statement of this event here, that no one should fall poor because of ill health. So it's the main statement of the Tallinn Charter, but yet even in Estonian case, we see that we have a significant share of population who have catastrophic payments, and these payments are concentrated among the low-income households. One could question, where do these inequalities come from, or why do we have them? One of the answers, among many others, may be the limited funding for health in Estonia. When I started my presentation in saying that we have been held with that we have good health outcomes, we have been held in this sense that we also spend fairly little on health. We are rather a lower spender publicly on health in EU comparison. Furthermore, our healthcare system has been challenged with the financial sustainability because we rely mostly on the social contributions. I'm lucky to say that in 2018, the Ministry of Health made significant reforms in health system financing in Estonia, starting to make transfers from the state budget to the purchasing agency to increase funding, public funding for healthcare services. During the COVID pandemic, this was even more necessary because we had a reduction in the contributions, in the labor tax. So therefore, the government needed to step in to fill this gap. Furthermore, to pay in addition to basically manage the pandemic. So year by year, the government transfers to the purchasing agency budget are increasing, and by the year of 2021, the government transfers are almost a quarter of the total purchasing agency funding. Nonetheless, not all the population who is contributing to the system through general tax revenues is not entitled to all the services that the purchasing agency finances. And this leads me to the governance-related question, because the purchasing agency has been receiving more and more tasks in the past years, but its governance structure has not really been revised, taking into consideration these new tasks. For example, it's now responsible of ensuring access and organizing the primary healthcare system, procuring vaccines to the whole population, providing services not only to insured, but all, like I mentioned. And the government system has remained the same. So there are no policies implemented to ensure effective checks and balances. I cannot avoid the topic of healthcare workforce, as this is a burning challenge in many of the countries. And yesterday, although it was discussed that we never have had in Europe such a big number of healthcare workers in our systems, we still see that Estonia is lagging behind in EU comparison. We have less nurses than in EU on average, and we have less doctors than in EU on average. But particularly, we have a lack of nurses and the lack of family physicians, because when in 5 years we were discussing that we cannot find a family physician for some remote locations, then in today's case we are already discussing the challenges of finding a family doctor in more urban areas. Furthermore, with the policy changes of increasing the importance of primary healthcare and wanting to extend the services delivered at primary healthcare, we are lacking some necessary staff to better support the primary healthcare providers. Furthermore, we have a burning lack of mental health experts. And many reports have been indicating that it's not possible to sustain the same quality and access to services, possibly in the future in Estonia, majorly because of the lack of the medical professionals, and partially because of the lack of the financing as well. The HiT in itself, when looking at the health systems section or health services section describing the different parts of public health services, primary healthcare services, hospitals, secondary care services, it's very detailed and long, and we have written there multiple reforms that have been conducted throughout the years, as Estonia has been very much focusing on increasing the role of primary healthcare, building multidisciplinary teams, and putting EU investments in primary healthcare. Furthermore, it has emphasized the need to focus more on mental health, There have been analytics done on restructuring the hospital network. Nonetheless, there is still not in place an overarching framework of the health system providers network throughout the different levels. On the slide, though, you see something else. So on the slide, I have emphasized the need of tackling the growing burden of NCDs. And now referring back to my first slide, when we indicated what are the reasons that the Estonian people mostly lose their health or die, then these lie in the NCDs. We see that the avoidable hospital admissions for ambulatory care-sensitive conditions in Estonia is doing fairly good in EU comparison. But nonetheless, there are some conditions where we perform worse. And The Lancet has published a recent study indicating that especially the outcomes for hypertension are poor in Estonia. And this is something that we could tackle with further strengthening the primary healthcare system. And now to the final content slide on the challenges related to crises. Because if we think of what the crises do, is they tend to bring out the most burning issues in the systems. And this is what we were faced with during the COVID pandemic as well. So firstly, the coverage policy. During the pandemic, we realized that we need to change the regulations quickly to enable free services to all population, not only to the insured, but now only the crisis that has embarked on the Russian Federation invasion of Ukraine, which has resulted to a lot of Ukrainians coming to Estonians. We see that our coverage system that we have in place, it fails these people. Although they have the same entitlement as the general population does, they're not so aware of the system to navigate it and get the insurance. So therefore, a lot of Ukrainians who have come to Estonia do not have health insurance coverage. And the second challenge is the health financing, which I mentioned, because of the contributions that the state budget had to give for the purchasing agency in order not to cut any health services in the midst of a pandemic because of the loss in the revenues, but also as a result of the war, when the health services prices have been increasing and the cost of living has been increasing, it threatens the household's capacity to pay for the healthcare services. But nonetheless, I need to say that Estonia also made a very good use of the crisis. So never let the good crisis to be wasted. We were able to make some of the really crucial reforms we had been long waiting for in the system thanks to this crisis. And one of them was, for example, introducing the liability insurance for the healthcare workers or restructuring some of the governance. And we were lucky to embark on the very extensive digital data and the digitalization systems to make quick access to, for example, testing or identifying risk groups during the pandemic. To summarize, for this period of 5 years, throughout this period, the most significant thing in the healthcare system is potentially the National Health Plan, the revision of the National Health Plan. Because knowing where you want to go is essential to stay on the path. I don't assume for you to read the section, the print screen section that I put here from the National Health Plan, but as you see, it actually addresses already many of the challenges that I've been mentioning in my presentation as well. And we hope very much that this National Health Plan put in place enables to monitor progress towards these goals that have been achieved, that it's also a tool to allocate and direct resources to services where the most burning need is, and also it helps make or define basically it helps to set accountability for the targets that have been defined as well. So even on the level of general public, to make the policymakers really accountable of the defined targets. And to sum up the key takeaways from this process of putting together the main data in the country. Firstly, health statuses and access. Much can be done in reducing inequalities to improve health outcomes. So one of the key messages that we have in this HiT is that if we want to improve the well-being and health of our population, if we want to increase the number of healthy lives among Estonian population, then the biggest impact can be made in the target groups who are currently left behind, meaning the low-income population, ensuring that there is access to services for them, and also developing policies to help them to make healthier choices. So this is the place where the biggest impact can come from. A message that was mentioned already, also moving towards universal coverage has been, in more recent years, been on the political agenda, but nonetheless no decisions have been made up to today. Financing, so there is a need to increase public spending on health. And these are probably one of the biggest challenges in upcoming years to fill the holes in the health insurance fund budget. And this is also related to the governance and considering the changes to the health insurance fund's role within the healthcare system to still ensure efficient checks and balances. The human resource I have already addressed. So the future challenge is how to define a comprehensive strategy, looking at the human resource development, not only of looking like admission quotas, but also having a comprehensive approach to human resource development. On healthcare provider networks, what I mentioned, the challenge is to define what the healthcare provider network should look like throughout the different levels of care. And in tackling the growing burden of non-communicable diseases, the biggest impact can be made when improving and extending the services provided at the primary healthcare level. I thank you so much for listening. And I will give the word back to Christina.
Thank you, Julia, and thank you, Kaia, for walking us through the last 5-year reforms and challenges that Estonia faces. It is an honor for me to now invite our distinguished panelists on the stage to join with me and Kaia. We have Minister Riina Sikkut, Minister of Health of Estonia, who was also, as you already heard from Julia's presentation, the author of the 2018 HiT. We have Dr. Natasha Sopardi-Muscat, Director of the Division of Country Health Policies and Systems at the WHO Regional Office for Europe. Natasha has also been author of many of the HiTs in her home country, Malta. Evot von Ginneken, who is coordinator of the Berlin hub of the European Observatory on Health Systems and Policies at the Berlin University of Technology, and Evot has been the editor of many of Estonian HiTs before. So I have the pleasure. Thank you. Julia and Kaia presented us the last 5-year reforms and changes that have taken place in Estonia, but also highlighted the challenges. So, Madam Minister, I have a question to you. Could you briefly reflect on the challenges and key takeaway messages that Kaia presented. And as you were the co-author of the last HiT in 2018, do you see the changes? Have there been some changes as well in your view of the challenges?
Thank you. And since I'm in a very honorable crowd here, people who have written many hits, so I can be called a one-hit wonder, 2018. But yesterday, an Estonian journalist asked, well, you have looked at the numbers and you're familiar with the health in transition, so was there anything that surprised you in this year's HiT? And I was a bit taken aback. Well, and yes, actually, there was something that in general we feel that the life is improving, that the incomes are higher, we have better level of education, we have more support services in schools and so on. There's reformulation of, food products by the companies. And somehow you hope that things are getting in the right direction or are moving in the right direction. And when you look at the data, the inequalities, they don't disappear by themselves. Then you hope that maybe this year's HiT shows that, the regional disparities or health status inequalities by income groups are disappearing, but no. And then this actually lies very heavy burden on my shoulders that we need constant steps and political decisions that actually increase or offer adequate financial protection for all income groups. And we need to make the political decisions to improve the situation, because otherwise the gaps will only widen. So this is my main takeaway, and also for, this assignment for the next years.
Thank you very much. And I'm sure that in collaboration, WHO and the Estonian Ministry of Social Affairs can work on that important topic to decrease the inequalities that we have. But I do have one additional question to you, Madam Minister. As the focus of the conference is, one of the focus topics is trust, and we mostly focused on it yesterday. But I have a question for you as well. That do you see that the lack of trust is also relevant or issue in Estonia, does it also hinder the system to develop further? And if so, what kind of transformation is needed in order to regain the trust, to improve the health system so that they would better respond to the needs of the people?
Yes, trust truly underlines the changes we need to make, whether it's trust into politicians or towards healthcare workers, and also trust into that the change for better is actually possible. But as Kaia covered a lot, the COVID impact in Estonia, as I imagine in some other countries also, the anti-vaccination, campaigns and misinformation campaigns eroded trust towards certain medical procedures or treatments. But the curious thing about Estonia is that at the same time we had quite a high level of trust towards digital solutions. So it can be the same doctor who uses the electronic health record, who offers you the vaccine, COVID vaccine, for example, but you trust that the decision support system and the electronic prescription that the doctor gives you, but the recommendation to vaccinate against COVID, there's no, I don't trust you with this recommendation. So even when we discuss trust, there are many layers, and you have to understand somehow the wider cultural context. So, and it varies, I believe, country by country. So maybe we can learn something from the trust towards digital solutions and learn from that to build trust towards other aspects of service provision or health system design, where we see that the increase of trust is needed if we want to improve public health or health outcomes.
Thank you very much, and thank you for highlighting the need to build the trust further. I think this is something that we have heard over yesterday, and still that all the countries are facing it, and we need to work on it together to improve it. Dear Natasha, as the focus of the conference is also on transformation, could you please reflect on how Estonian health system has transformed over the years from the perspective of how well has it lived up to the values of the Tallinn Charter, the solidarity, equity and participation, and where do you see that the stronger focus should be placed to meet these values better?
Thank you very much, Christina. And let me just start by saying how honored I am to be on this stage with current, former HiT authors. And it's a burden to be in a position now where we are, Arena.
Yeah.
I think 5 years ago, writing the HiT report, with all due respect to everyone involved in HiT reports, you know, there's always so much stress about how you write, how you say it. You want to be clear, you want to be critical, but you don't want to be too critical that people then feel that you have been unfair and disengaged. But then the real test, I suppose, is how to make this progress. And thank you for being so frank and open. And in fact, my reflections on having read the summary, I will be honest, I haven't managed to read the full report. I will try and dip into bits and pieces because I'm very interested in what you are doing here in Estonia. Of course, coming also from a small country myself. But I think clearly there is this sense that Estonia is trying to live up to the core values of the Tallinn Charter that goes beyond lip service. And in fact, we know, for example, you have the solidarity-based health insurance, which is, of course, a very good start. But like any other country, and I guess the key message is don't feel alone. I'm sure many others in this room are also struggling with the aging population, the long waiting times, the backlogs with COVID still, and the increased demand, I think, are one of the challenges. But what happens then, particularly, is that when the publicly funded services cannot deliver to the level of expectation that people are expecting, besides the fact that the trust gets eroded, what we tend to see is that maybe a portion of the population finds alternative means to get ahead, and others risk getting left more behind. And of course, sustainability is an issue, so one cannot just suddenly overnight expand also the financing on the publicly funded services. But as you said so very well in our small countries meeting, which was just the day before yesterday, it feels like a very long time ago, and we hear this echo from more and more ministers, financing sometimes is not the only bottleneck, and more we are finding that workforce is a bottleneck. And here we are very glad also as WHO to continue to work closely with Estonia to really try to develop a concrete plan for focusing on the health and care workforce. And I think that's one also of the key reflections that I would have reading this report. In terms of the UHC financial protection report we launched for UHC Day yesterday, I'm very pleased to say also, of course, that Estonia has a very strong tradition of focusing on financial protection, and you have very good data. And largely here, you are not doing badly. But again, the fact that we still don't have 100% population coverage. So if you had to ask me, Natasha, what should I really focus on? Because I can't have too many things. I guess I would say, Rina, the health workforce. Let's work on the health workforce strategy. Let's see what arguments we can put in place to reach this 100% coverage in the population, so as to make sure that we are leaving no one behind. And maybe finally, as a third one, then perhaps even not to forget issues such as dental care, because we have overlooked them, not just in Estonia, but in all countries for far too long. But I would like to end on a very positive note and say that there is a very good foundation and basis and ethos and commitment, and also a very professional public health and health systems workforce. For a small country, Estonia actually exports experts to other countries. I have been a recipient on a bilateral basis in Malta. Now in WHO, I see more and more. And of course, this does not surprise me because Mark is still with us in the room. In the latest OECD report, we see, for example, PISA survey that Estonia is doing very well. So again, I think just keeping an eye on who is likely to fall behind when there are so many people who are doing well and getting ahead and being digitally literate and have good levels of education is where I would put the focus. Thank you.
Thank you, dear Natasha, highlighting that Estonia is trying to solve the problems, but of course there are still challenges that Estonia is facing. Dear Evat, I also hope that you have some recipe for Estonia in a way. You have been the editor of the multiple Estonian health system in transition reviews before, but also in other countries. So maybe you could please briefly reflect on whether the Estonian challenges, successes, and developments are similar with other countries as well.
Yeah, thank you very much for that really important question. But of course, I would also use this opportunity to say, my journey with health systems profile started in Estonia. My first HiT that I did alone was the HiT for the 2008 Tallinn Charter. So my journey together with you, also in the observatory, is really closely aligned. And it's just very gratifying to see that all the people who were involved back then, and many of them are still involved today, have spread their wings and they've become important voices within the country, but also in other countries and international organizations. And Rina, I can say Rina because we worked together very closely on the assessment chapter 5 years ago, and it really creates a bond, is a perfect example of that. One that I always use actually when we try to convince people, please help us write this HiT. It's very good for your career. Look at Rina Sikkut. She's now the Minister of Health in Estonia. But also to be married to a HiT author is actually a very good thing for your career. We have, in Portugal, we had a HiT author whose wife became the Minister of Health. So also by association is very good for your career as well. And then, you can justify the time that you are going to invest. So I'm very, very proud of all of you and the team, for delivering, again, for a 4th time in a row, against a very tight schedule, a HiT. And that is something that I don't think I have seen before. And it did change also the way we work as observatory with countries. The way we work with Estonia became a model of how we try to work with other countries as well. And then thinking of it, how do we work with you and why is it so effective? And then when I was thinking about that, I also saw the parallels with your health system. And one is that if you are the editor and you're working with a team of dedicated authors, what you need to do is create trust and show that you deliver and improve. And that's exactly, well, sounds familiar, I assume, after 2 days of this conference. And that's exactly also what I see if I look at on a very long perspective to the Estonian health system. There is this incredible work ethic to succeed here that I felt already in 2008. And if you look at, for example, the system, your obsession almost with data and analysis, to also be able to speak openly and also about the challenges and also the willingness to do something about it, even though, of course, we have challenges and it takes years sometimes. We've been flagging up in the HiT, for example, the revenue base that was too reliable on payroll contributions, that it needs to be done something. But finally, after many years, something is happening. We are definitely moving in the right direction. Also, the planning that you were using, and still how critical you are on how the plans are today, hospital plan, national health plan, adding targets, improving them over time, I think are really important for a country to have and for the population, and something where I think Estonia sets an example. And then again, your obsession with e-health and just digital in general that I already saw in 2008 and was so visible during the conference even back then. It was broadcasted online even. I think that was the first for me that I ever saw that. So these are the things that I think internationally we can really learn from. Of course, there are many, many challenges, but you are approaching them. So in that sense, I often use Estonia as an example of a country that has an open culture to find solutions, practical solutions often to the problems you have. So that is in short what I would like to say at this joyous occasion. And I think I'm allowed now to give the HiT to you, Minister Sikkut. And not only the HiT, I have another present for you. This is a collector's item. This is the original, maybe if Jarno is in the room, he probably will recognize it, the original bag of the 2008 Charter. We even have the pin in there for you, the pin that you can put on your suit if you suit up later. And of course the HiT, so I'm very happy to be able to give these to you. Oh,
Thank you.
thank you.
Thank you.
And for you.
Yeah. For a museum later on, yeah?
The museum, a prominent spot in the ministry or any other good place.
Of course. Thank you.
Thank you.
Thank you very much, dear panelists, and thank you very much, Kaia, as well. Dear participants, I would like to now open the floor for you to ask any questions that you might have for the Estonian health system in transition review authors or for our distinguished panelists. So please raise your hand. We do have 2 volunteers in the back with the microphones as well, if you would like to ask any question. Yes, please.
Good morning still. I'm Maris Jesse, author of the first and main author of the second Estonian HiT. So I have quite a long history into it, but I would like to ask that what do you see are the barriers for Estonia on the way to achieving universal health coverage? Why are we still not talking about it? Why are we still not tabling these proposals to the political decision makers?
I can start, but maybe the view from outside is different. But I reached the conclusion that in Estonia we see this as an ideological question, that universal health coverage, it's like a political position, without realizing that what is the evidence-based recommendation. If we want the better health outcome, if we want a well-functioning health system that actually uses taxpayers' money in an efficient way, the universal health coverage is the way to achieve it. It's not a topic for taking political points or creating a conflict during an election campaign. So and we in Estonia believe in a very efficient use of funds. So it should be the logical and the right decision, but for some reason we haven't gotten that far yet.
Thank you very much.
So maybe just to say that, of course, this is something that we see in other countries too. And there is sometimes a sense that it's based, as we see, not just on ideologies, but also on a full sense that everyone is covered within the general sort of population. Yeah. And then you really need to show the evidence that actually it is not. And then people might say, but I mean, okay, if whatever, 3-4% are not covered, what implications does this have? And I think it's important also to try then to go in with the science and to show the implications from a science point of view. Yesterday was very interesting in the closed lunch session on emergency services. We were hearing from many tables, for example, that emergency services are often also overwhelmed because they become the only point of recourse for people who are not otherwise covered. So sometimes it's also even trying to explain, to move away from the ideologies and go in with a very pragmatic approach and numbers.
If I can add to that, this is a point that we are really investigating and needs much more attention, better data to signal what is the actual coverage in the country, because we are indeed too complacent to think everybody is covered, which is not the case. It's not just population coverage. If it's just everybody covered, we still see huge differences in the benefit package. And even if you look at the benefit package and how people are actually treated, and that's an exercise we did for the European Commission using a vignette study, you can see there were huge differences between countries, how they would treat patients, and many of the actual services a person would be expected to get, according to the latest standards, were not covered. So I think we have a long way to go. I think that in Estonia it's very visible because there's also a relatively large share of the population uncovered, but we should not think in Europe as a whole that we are doing really great on coverage, and I think this is a point of our attention and work for the years ahead. And dental is one that we have published something about together. There's also a HiT on dental care, if you haven't read it yet. It has all the arguments, Minister Sikut, so I'm happy to come and talk about that whenever you need me.
Thank you very much. I saw another question from the floor.
Yes.
Madam, please, could you introduce yourself and ask your
It's working? They say it's working. I'm Aiga from Latvia. And I would say that we are very pleased regarding this event today. And one thing we would like to praise Estonia is their honesty. They sometimes are very frontally honest, and I think it helps you move forward. And therefore, my question is related to that. When the next HiT comes, which will be the chapter, the first one you will look at to see if you made a difference? Thank you.
I would start with health workforce. I see this as the biggest challenge. We can fight over money or other issues that are more interesting for the media and more sensitive politically. But if we can't solve the health workforce shortages, then there are other things that we fail behind in. So.
Yes, please.
Thank you. Breather Rafter from the Ministry of Health in Ireland. Thank you for the wonderful discussion. I really thought it was very informative. Just on the question of universal coverage, we have the political commitment in Ireland for universal coverage. I think the key barrier is financial. It's the cost of universal delivering free healthcare to the entire population. I suppose the key question for me is how do you deliver universal coverage that is efficient and affordable for a country? And I'd like to comment. I was delighted that the Minister referenced the health workforce. Health workforce is my area in the Ministry of Health, and it's a significant challenge. Like Estonia, we have a shortage of doctors and nurses. And we don't, there's key challenges trying to build that future supply. So it's a significant challenge for the future. So thank you.
Maybe I will take the possibility to reflect on this and a bit reflect of what Maris mentioned on the barriers as well, because it was nicely mentioned that in PISA we're doing really good, right? But we're doing good because all of the public funding that we have, we spend significantly more on education than in EU on average. But in healthcare, we spend significantly less on average of the public funding to healthcare. So it's the priorities that we do have and how we spend our public funds. In Estonia, the healthcare system has been lagging behind, but I'm very happy to say, as a author of the very recent HiT, that we see progress. So health has gained increasingly importance in terms of the general public funds, and we, as in the next HiT, I would look at the financing chapter. So I would look at whether we have finally managed to reach up to the EU averages on how much do we prioritize the health in the general budget.
Yes, and I'll add that we have had this societal agreement that we put 2% of GDP on defense, and now, due to the Russian war in Ukraine, it's 3.2% of GDP to defense. We put 1% of GDP for research and development, but we never had this type of political agreement or societal demand on agreeing financing, sustainable financing for healthcare. So just as Kaia described, we've always, over the past 32 years, if we put €1 to health, EU average is 1.5. So, and continuing on this level, putting 50% less than other EU countries, it has an effect, and we see the growing inequalities, the low level of financial protection. But the positive side is that it's not that expensive to provide universal health coverage, because we cover emergency care for everyone. So, and the data shows that uninsured people show up in emergency departments, and we pay 30% more for their treatment as we do for people with similar socioeconomic background, similar age, similar diagnosis. So if we can move the uninsured people to use primary health care, screening programs, preventive services, well, we may provide universal health care with very little extra cost.
I think that's worth an applause, of course. No, I think this is really about building the investment case, and I think there's also a real plenary now later on this exact issue, that we need to show with evidence that investing in health is a good investment, and there will be a return of investment, exactly along the mechanisms that Minister Sikku just said. And I think that what we can do as WHO, as observatory, is help providing these evidence, and we try to do that, of course. And because I think the case is clear, but it's not always that well known to the public or policymakers.
Perhaps just to add to this, I think what we are increasingly now seeing and trying to put into our narrative as WHO is that when we invest in the health system, we don't only get health dividends, we actually also get dividends for economy and the labor market, particularly, for example, many countries are worried about the mental health of younger people and what this is going to mean for their labor market. But also in this one we talk about perhaps a little bit less societal cohesion and what this means for internal security and everything else. And I think there's increasing evidence in this vein too. So now when we talk about the need to invest in health, we talk about the need to invest in health for health itself, but also for prosperous economies and for cohesive societies.
Thank you very much, dear panelists, for your reflections. And thank you very much, dear participants, for your active participation. We are closing now this session, but the next plenary session, which is Investing More and Investing Better, starts in the same room in 11:45. So thank you very much. So please. Yeah. Yes, yes. We will stay and make a photo. Tulka.